here's a challenge for you. What do these two things have in common? The first was a simple sticker that cut public toilet cleaning costs by 80%, just because no one can resist a target. Let's take a more serious example. In the 90s, changing paracetamol from tubs to pill packets would go on to save 800 lives over the next few years, simply by making it marginally harder to overdose. So what's my point? My point is that tiny behavioral nudges can have profound consequences. And when it comes to healthcare, a patient's behaviors actually account for up to 50% of their medical outcome. That's more than their genetics and more than their clinical care. As a doctor on the cancer ward, I saw patients unable to bridge the gap between what they should be doing and what they actually did when it came to managing their medications, their side effects, their nutrition, their sleep, their exercise. And it was those behaviors that meant they didn't tolerate their drugs and get the chemotherapy they needed. That's where Vine Health comes in. We use a combination of behavioral science and AI to extend the lives of cancer patients by months and potentially years. Our platform allows patients to track and understand their own health data, and our proprietary algorithms detect patterns in that data, allowing us to deliver personalized nudges that put patients back in control. And we close the loop by feeding that data back to clinicians. We already have 12 clinical partners in our pipeline, giving us access to over 1 million cancer patients. But here's where it gets really interesting. Pharmaceutical companies are pouring $150 billion a year into inefficient oncology trials. And recent regulation changes mean they can no longer get paid for their drugs unless they have real-world, patient-generated data. And that data is exactly what Vine Health generates. That's why we're at the center of conversations with 2 contract research organizations and 7 of the 10 largest global pharmaceutical companies. So who are we? I'm Raina. I'm a medical doctor and neuroscientist, and I'm CEO of Vine Health. Since graduating top of my year from medicine at Cambridge, I've spent the last 10 years in frontline healthcare, government policy, and neuroscientific research at Harvard, Cambridge, MIT, and Columbia, as well as at the Cabinet Office's Nudge Unit. My co-founder, Georgina, is a data scientist. She led GSK's first ever data-driven clinical trial and was instrumental in taking one of the fastest growing medtech startups in the country to Series B as head of their data science and part of their executive team. And the most prominent advisors in the field have joined us. But I'll leave you with this. In our 60-patient beta, 95% of patients onboarded, and 39% went on to be daily active users. This is what one of them said. Since I've been using Vine Health, I've been able to talk in more depth with my doctor than I have in the 4 years I've had cancer. He's finally able to manage my pain, and I'm finally coping with my chemo. It's life-changing. And that's why we built Vine. Come and talk to us.